Do we offer solar keratosis freezing? No, we don't. So solar keratoses are areas of sun-damaged skin, and they can be a nuisance more than anything. And freezing is a kind of standard treatment for them, which is liquid nitrogen, kind of like a gun. Looks like those squirty cream guns they got at Starbucks, but it sort of squirts liquid nitrogen, which freezes the lesion and kind of kills it. Basically, kills that piece of skin, superficial. Very good for superficial lesions. Very good for multiple lesions. I think is it the same? I got they sent me a photo today of a patient with lots of lesions, and sometimes when you've got lots of lesions, especially if they're superficial lesions, then things like cryotherapy or freezing is good for that, because we only really do surgery. We only really cut things out. So if you've got lots of sort of superficial lesions, you may not want to have them kind of all cut out or shaved. It's much easier in the clinic just to multiple cryotherapy things. So that's certainly probably your first port of call. And then we might get involved if it came back, or if there was one or two which were a bit resistant to that, so they're a bit deeper, a bit thicker, then maybe you want to think about another sort of treatment, maybe a shave, maybe an excision. But yeah, freezing or cryotherapy is kind of first line for a lot of multiple lesions, and that would probably be, sometimes the GPs do it, but dermatologists will do that. So dermatologists are good at the sort of more, they do a lot of more of the non-surgical treatments like that. So yeah, we would not do that. But as ever, you can always send us a photo and we will give you a view on it, and let you know whether it's the sort of thing that we would do, or it will be some other type of doctor like a dermatologist or